Have you ever wondered how you can be a real hero? How you can truly save lives? Well, good news for everyone watching this video. There's a way you can do just that. And that is to help stop the spread of hepatitis B. Now, for those of you not familiar with hepatitis B is a viral infection. It's spread from infected person to someone else through contact with blood or other body fluids. It can cause a serious liver infection, and some of these infections can even last longer than 6 months. If an infection does last longer than 6 months, it's considered a chronic condition. Once it develops into a chronic condition, a person is at an increased risk of liver failure, cancer, and cirrhosis. And unfortunately, children are at the highest risk of it turning into a chronic condition. If a child is infected with hepatitis B, there is over a 90% chance it will develop into a chronic condition, compared to adults who have a less than 10% chance it develops into a chronic case. If someone develops symptoms, they will usually occur 1 to 4 months after the infection. However, some people do not ever show symptoms. If someone shows symptoms, they will tend to range from mild to severe and can include abdominal pain, dark urine, fever, joint pain, lack of appetite, nausea, fatigue, and jaundice. The picture on the screen shows someone currently experiencing jaundice. The biggest thing to notice is the yellowing of their skin and of their eyes. So who's at the highest risk for hepatitis B? Well, it's anyone involved in a socially active population. This is why those in their 20s and in their 30s have the highest infection rates. So some of you might be really freaked out by this point and wondering, is hepatitis B as bad as a zombie apocalypse? Well, not really. There are, though, some real similarities. For one, there's no cure. If a zombie apocalypse did happen, no one would really know how to stop it, just like there's no real cure for hepatitis B. There are some notable differences between the two. For one, you can see a zombie coming. They might sneak up on you or be slowly wandering from far away, but either way, you can tell who's a zombie. They will seem like the most disgusting and fascinating creature you've ever seen, whereas you have no idea if someone has hepatitis B. That actually might make it more scary, though. Well, to make you feel better, not everyone that has hepatitis B develops terrible symptoms. This is much different than a zombie who, if it bites someone, that person is pretty much doomed. Even though hepatitis B is not quite as bad as the zombie apocalypse, it still affects a lot of people in the world. That's why prevention is key. The best prevention method for hepatitis B is to get vaccinated. This might seem simple, but this is actually quite difficult to some people. For one, access can be quite difficult. That's why we must work together to increase access to the vaccine for everyone. Also, some people might not realize the importance of the vaccine. That's why educating those who are skeptical of its effectiveness and safety is very important. Also, using barrier contraception is a key prevention method, as well as basic hygiene like washing your hands. Also, do not share personal items. These items can include needles, toothbrushes, razors, glucose monitors, or anything like that. Also, screen pregnant mothers because they can pass it on to their child. Hepatitis B is something that affects a lot of people, which is why learning about it and preventing it is key. I hope you've enjoyed this video. Don't forget to share it with your friends and send a link to those throughout your social media. Thank you.